And welcome back to Talk of the Town. I'm excited to introduce you to Door Creek Dental's Dr. Hinto Schwalbach and Dr. Scott Kirkpatrick.
Thanks for having us.
Yes, welcome. So let's first start with, what age should a parent bring their child in for their first dental appointment?
That's a very good question. At Door Creek Dental, we do see a lot of kids at our practice. And according to the American Dental Association, the recommendation is to bring your child in 6 months after they get their first tooth in their mouth. Many parents would think, wow, that's really early. But it's true that kids can get cavities at a very young age, especially if they're drinking juice or milk from a sippy cup or a bottle. So what we do at the first dental appointment is check their teeth and check their gums and check their mouth and answer any questions that a parent may have. A question that I get a lot is how much toothpaste to give my child. The answer really depends on how old the child is. If they are younger, they have a tendency to just eat the toothpaste. So I tell them only brush with water or else a non-fluoride toothpaste. Between 3 to 6, you can use a scrape of toothpaste, which is about the size of a grain of rice. And at around 6 years old and older, they can spit it out, so they can use that pea-sized amount. The most important thing that I would like to emphasize is that early childhood dental exams are very important. Dental chickens are hatched very early. So at Door Creek Dental, we do our best to make your child's first appointment as positive as possible so that they won't be afraid to come back.
And how often should families visit the dentist?
Most of our patients come twice a year, but at Door Creek Dental, we have a great staff of hygienists, caring hygienists, and they do a thorough evaluation of the gums and then a real clear explanation of what the status of the gum health is. And that's how Dr. Schwalbach and I will make our recommendations based on the health of the gums. So a lot of folks come in twice a year. A lot of folks come more because they have higher needs. So we're just going to prescribe it according to what their needs are. Another thing at Door Creek Dental is usually we have 4 hygienists scheduled on a daily basis. So that allows for families to come in at one time, a convenience factor. We have days where we'll have all the hygiene chairs filled with the same family. One of the front office staff will be pushing around a stroller or carrying a baby, so it's kind of fun, and we try to provide that convenience for it. The main thing is we want to be thorough. We want to diagnose disease if we find it. If necessary, we're going to use low-dose x-rays to look for dental decay and for gum disease and bone loss around teeth. And we want you to be aware of what diseases there are. That leads to prevention. So that's our main primary goal, is prevention. So what can we do to keep you from having dental disease? Early detection is another thing. We want to find those cavities or gum concerns long before they are not treatable anymore. So that's what we're going to focus on with our examinations.
For someone who hasn't been to a dentist in a while, tell me about some of the new treatments that are now available.
One of the treatments that your viewers may have heard about is Invisalign clear braces. So in the past, the traditional way to straighten crooked teeth was with gluing on metal brackets and wires. I have a sample here. Invisalign is a treatment that uses a set of clear aligners. These are removable. They are switched out about every 2 weeks. And over time, these aligners can straighten your teeth and get you that smile that you've always wanted. The adult patients really like this treatment option because, as you can see, it's nearly invisible. When you are wearing these aligners, you can't even tell that you're getting any dental treatment done. At Door Creek Dental, we do offer a complimentary consultation appointment to check your smile and check your bite to see if this type of treatment would be appropriate for you and would benefit you.
Great. What about any new cosmetic procedures?
One of the main questions we get from patients, and it does fall in the cosmetic lines, are dental implants. so way to replace missing teeth. Dental implants are small titanium screws that are placed into the jawbone, and they replace the natural root of a tooth. They're appropriate treatment for young adults who were born without certain teeth, so they just never had them and would sure like to get them back.
Well, thank you so much for sharing all the different elements of your practice. It was great to learn about that, and thank you for coming on.
Great, thank you very much.
And this has been Talk of the Town, and have a wonderful rest of your week.